We had a very normal pregnancy and we had no real problems during delivery. He was a big baby. He was 10 pounds, 4 ounces. But the next day, on his first day of life, he was really having trouble feeding. He was having trouble with nursing, and that's very common. I was a first-time mom. I didn't really know how that process worked. We indicated that we needed some help from a lactation consultant.
It was probably about 12 to 14 hours after baby Jay was born, as I refer to him as. Asked her if she wanted to get Jay started feeding, and she said he hadn't really been that hungry. I said, well, I'm here. Let's give it a try. And so he seemed so eager, and he would latch beautifully, but I noticed he didn't really have a whole lot of energy. And for a baby a little over 10 pounds, I did not expect that.
And she noticed that he was having some trouble breathing. His nostrils were flaring, and he really seemed to be working really hard at nursing.
Not wanting to alarm anybody, I said, Jen, he looks like he's might be having a little bit of difficulty. Do you mind if I'm just going to go ahead and take him to the nursery and check this pulse ox to see what his oxygenation level is? And she goes, no, that's fine. I took him down, and his saturation levels were well below normal and were not coming up quickly. So I needed to get him downstairs to the newborn nursery.
There was some concern immediately that there was something that was not quite right. They were looking at a number of things, but the following day they realized that he had a congenital heart defect, and he was going to need surgery to repair that. And he had had his first heart surgery when he was 5 days old. It's so scary as a new parent that you just don't know what to expect.
Every family needs and deserves that care, that one-on-one care when I'm in a room with them.
I'm just amazed at the level of sensitivity that she showed. She followed him to the nursery and then followed him all the way to special care, and then came back and talked to me about what had happened. Moira was absolutely paying attention to everything and noticing when something didn't seem right, and that was really changed the outcome that he would have had. Because if we had gone home, who knows what might have happened if he had not been diagnosed before we left. He's 5 years old now, and it's so amazing to see him running and playing and jumping, and to know that you can go through those really stressful times and then still have a perfect outcome. With Jay, I really credit her for saving his life, for being so attentive to the special needs that he was having.
I'm just really proud that I was able to pick up on those little subtle skin changes and breathing changes that might not have been picked up. So I guess I'm just honored, and I'm happy that baby Jay's here.